Continuing now in chapter 28, looking mainly at the female reproductive system. So first of all, the anatomy of the female. So we have the ovaries, uterine tubes and uterus, the vagina, then the external genitalia organs, as well as the mammary glands would also be included with the reproductive system of the female. And just looking at where those parts are. So again, we have the ovaries here where those eggs would be formed and then released into the uterine tube, also known as the fallopian tube, traveling down into the uterus, and then at the end of the uterus here at the cervix, and then continuing out here to the external opening of the vaginal opening. And then we have the labia minora and majora on the outside, making up that external genitalia as well. Now, if we look more specifically at the ovary, so we have what's called the broad ligament, which is part of the peritoneum, and then it spreads out on both sides of the uterus, and this is where the ovaries and the uterine tubes attach. So the ligaments here of the ovaries, we have the mesovarium. That's the peritoneal fold that attaches the ovary to the posterior surface of that ligament. The suspensory ligament, so we're thinking about suspending something, that goes from that mesovarium to the body wall. That's where the arteries, veins, and nerves would actually be coming in, so the blood supply as well as neural communication. And then finally, the ovarian ligament. This is going to be the ovary to the superior margin of that uterus. So again, just looking at each of these. So again, the broad ligament shown here. So we have our ovaries here with the eggs forming. We have the uterine tube up here. So again, our broad ligament in this area there. Now looking at the histology, the outermost part is called the ovarian epithelium, which makes sense. Our epithelial tissue is on the outer covering. This is made up of what's called the visceral peritoneum. Then the tunica albuginea, that's the capsule. This has fibrous connective tissue here, the ovary itself, and then within the ovary we have the cortex, the medulla, and the stroma. So the cortex is the outer part. It's very dense. This is where the follicles are with those oocytes that will become the eggs. The medulla is on the inner part. It's a little looser tissue. This is, again, where innervation is going to happen for those blood vessels coming in, as well as our nerves and the lymph system. And then the stroma is that connective tissue of the ovary. So we have some dense, looser, and then that stroma for connective tissue. And then just looking here at these various parts, you can see here the cortex pointing here to the outer part here with that dense tissue. Then we have the medulla more in the internal part with that looser tissue on the inside. And you can also see that mesovarium up here as well as it's going into that uterine tube. Now looking at how the eggs actually develop, which is referred to as oogenesis, so the production of the egg. So we have what are called oogonia. Those are the cells that are going to develop into those oocytes. So they're first called oogonia. These are dividing by mitosis, so they're diploid. They have 2 of every chromosome. They're going through regular mitosis, making more of them, and those produce what are called primary oocytes. So to begin with, again, diploid cells, we have what are referred to there as those primary oocytes. Just to kind of put some numbers, to put it in perspective, about 5 million oocytes are produced during the 4th month of prenatal life. So this is early in development that these oocytes are being made. And about 2 million start that first meiotic division, but they're going to stop at prophase. Okay, so just real quick, back to our biology. So mitosis is the production of identical cells. So we start with diploid cells. Here we have mitosis, so we have 46 chromosomes, 2 of each chromosome. So dividing by mitosis, they're creating identical cells that have 46 chromosomes. Meiosis, though, is going to take those 46 and ultimately divide them into half to generate haploid cells where they only have 1 of each chromosome. Right? So this first part here during mitosis, again, this is all happening during early development in the fetus. And most of them are going to start mitosis, going through that first round. There are 2 rounds of mitosis. So we have that primary oocyte going through that first round of mitosis, and then it just kind of hangs out. So it's going to start it, but it doesn't finish it. So those primary, those are going to stay there until about puberty, and that's when they're going to finish mitosis to actually trigger ovulation. So from the 4th month of development until puberty, they're just kind of hanging out there in prophase. Now those primary oocytes are surrounded by what's called granulosome cells, or also primordial follicles that are going to form those. They become what's called the primary follicle when the oocyte gets a little bigger. So those granular cells in the oocytes are getting bigger. It's now referred to as that primary follicle. That then becomes a secondary follicle and matures ultimately into the Graafian follicle. And then usually only one of those actually gets ovulated, and the others degenerate from that. Of course, we can end up with twins whenever more than one egg gets released. But again, during ovulation, typically only one of those would be released. So then during ovulation, now we're releasing that secondary oocyte from the ovary. This is going to be different than spermatogenesis that we'll cover in the next one, because here during meiosis, instead of creating 2 haploid cells that are equally, like they both have the same amount of cytoplasm, instead it's uneven whenever the cytoplasm divides. That's called cytokinesis. So we end with one polar body that's really small, and then what's called the oocyte that's really large. So they both have the nucleus, but one is extremely small. It's called a polar body. It degenerates, and then the oocyte is going to get the majority of all the cytoplasm with all the different organelles like the mitochondria and all of that to allow it to develop. Now back to the follicles, that Graafian follicle, that's going to become what's called the corpus luteum. And during fertilization, of course, that's whenever the sperm joins with that secondary oocyte and can penetrate into the cytoplasm. So the haploid oocyte from the female joins with the haploid sperm, and now we are back to that diploid state. And after fertilization, we have that zygote. Now that corpus luteum that came from the Graafian follicle, if we get fertilization, that's going to stay there and it helps nurture and allow for development. If not, it becomes what's called the corpus albicans, and that's what's going to ultimately trigger menstruation. All right, a little bit more about the uterine tubes, again, also called fallopian tubes or the oviduct, all the same thing. So we have the mesosalpinx. This is part of that broad ligament that we just talked about that's associated there with the uterine tube. Now it opens directly to that peritoneal cavity, and the point of the uterine tubes is to receive the oocyte. So again, the ovary produces the oocytes as they mature during ovulation. They go into that uterine tube. So then transport the oocyte or the zygote, if we get fertilization, to the uterus. A few different parts here. So the fimbriae, this is the thin processes that extend out from what's called the infundibulum, which is the inner surface that's ciliated. So the cilia are kind of like hairy little projections that stick off, and then it opens up to that peritoneal cavity. We also have what's called the ampulla. This is the widest part of the uterine tube, and that's where fertilization can occur. And then the 3 layers of the uterine tubes, we have the outer serosa, the middle muscular layer, and then the inner mucosa. So serosa, muscle, mucosa. And that mucosa, that has the ciliated columnar epithelial. So again, ciliated meaning they have those hair-like little projections, column, think about a rectangle, epithelium's on the outside, and then they have those longitudinal folds. And the point of that is to provide nutrients for the oocyte. The cilia help move the fluid as well as the oocyte toward the tube to allow that movement to occur. Looking at the uterus, we have a few different parts. We have the body of the uterus, the isthmus, the cervix, and the fundus all make up the uterus. The ligaments here, the broad ligament we already mentioned, we have the round ligament and the uterosacral ligaments. So again, we already mentioned the broad. The round is from the uterus to what's called the inguinal canals of that labia majora that's on the outside, the external genitalia. The uterosacral, that attaches to those lateral walls, attaches the lateral walls of the uterus to the sacrum. And we have three different layers here as well. So we have the parametrium, the myometrium, and the endometrium. And this was kind of similar to what we'd seen with the cardiac system. So we have the parametrium. This is made up of the serous membrane. The myometrium, that's more the muscle, so the smooth muscle for contraction. And then the endometrium, which is that mucus layer. So if you've heard of endometriosis, that's going to be affecting that endometrium, that mucous membrane of the uterus. And in that endometrium, we have the functional layer as well as the basal layer. So the basal is the deepest layer, and the functional is the inner part. And this gets replaced during the menstrual cycle. That's what is part of that, where it's being replaced and the cells are being sloughed off, that leads to the bleeding. It's that functional layer of the endometrium. And then finally, we have the cervix here. It's a bit more rigid, a little less contractile than the rest of the uterus there. And that cervical canal has mucus glands that go along it. And that mucus plug is there except whenever ovulation is going to occur, and that consistency of the secretion changes to more the serum mucus. Right now, if we look at the vagina, this is that organ for copulation. So this is where fertilization would allow. So during copulation, whenever the sperm get released into the vagina, again, traveling up to the uterus where fertilization can occur in that uterine tube. This allows the menstrual flow as well as childbirth. One of the parts here called the hymen, this actually covers the vaginal opening or orifice. And then the muscular walls, they have mucous membranes there that are lining it, made up of stratified squamous epithelium. And then the longitudinal columns, we also have what's called the transverse rug, and then the fornix, which is the superior part that attaches to the sides of the cervix. Now, finally, on the kind of external genitalia, we have the vulva, also called the pudendum. And again, that external genitalia. So here are the different parts. We have the vestibule, which is just the space there on the outside, made up of the labia minora that form the borders, the clitorius that's used for kind of an erectile structure, the corpora cavernosa and the corpora spongosa help make up that clitoris. The labia majora, that's going to form what's called the mons pubis. And then finally we have the vaginal orifice, and this is in the lateral margins. It's also like the clitoris, part of that erectile tissue that's called the bulb of the vestibule. Other parts here that we see within that vestibule, some glands that are going to produce fluid to allow a moist environment to allow for a better copulation. So we have the greater vestibular glands, the lesser vestibular glands, and then the periurethral glands. Again, all of these just are secreting fluid to moisten the vagina. The labia majora, those are the rounded folds of the skin on either side of the minora. That medial, so again, think about the middle compared to lateral, using our anatomy terms there. So those are covered with numerous sebaceous and sweat glands, again, increasing the moist nature in that area. That also, though, can allow it to be a hotbed for bacteria. So again, infections are possible in that area as well. And then we have the pudendal cleft, and that's the space between the labia majora. And then our mons pubis, as we mentioned earlier, this is anteriorly where the labia majora merges in an area over that symphysis pubis. And just kind of looking at the more visual aspect here to identify all the different parts of that external genitalia. Then we have the perineum. So this is similar to males. It's divided into an anterior urogenital triangle and a posterior anal triangle. So the clinical perineum, this is the region between the vagina and the anus. And this can tear during childbirth and sometimes has to be sewn or can be just very painful. Sometimes stitches are required, other times it will heal on its own. And then the epistostomia, this is an incision that occurs in that clinical perineum to help during childbirth. So sometimes, especially if the child is large or troubles, or if they're having trouble, they can cut that. So the procedure where they actually cut that so that it doesn't tear is called that epistostomia. I'm having a hard time with that word. All right, and then our mammary glands, again, we don't always consider the mammary glands part of the reproductive system, but in the females they are. Of course, this is producing where the milk is going to be produced in the breast. And we have glandular lobes that are essentially modified sweat glands and some fat tissue. The external structures, of course, have the nipple surrounded by that pigmented areola. And those have glands as well called the areolar glands to help lubricate and protect the nipple. We have what are called copper ligaments to help support the breast. And just some kind of give you some ideas here. In the adult, we have about 15 to 20 lobes surrounded by the fat. Each one has what's called a lactiferous duct that kind of opens up into a lactiferous sinus to store the milk during the letdown. So as the milk is being produced, the letdown is whenever it comes out so that the infant can nurse. So those sinuses fill with fill with milk during the letdown. And then again, just kind of looking here at those lobes, they get divided into what's called the lobule to form that alveoli. So kind of like what we see with the respiratory system. So those openings here, though, instead of containing air pockets, are going to contain milk. And then the myoepithelial cells surround that alveoli to contract and expel the milk. And then our last term here, the gynecomastia, this is where that breast development occurs in males.